What is the best initial treatment for peripheral arterial disease? A supervised exercise program. Pharmacologic therapy with cilostazol and percutaneous or surgical revascularization should be reserved for those with persistent symptoms despite adequate exercise therapy. What syndrome presents with a prominent occiput, overlapping digits, clenched fists, and rocker bottom feet? Edwards syndrome, which is also known as trisomy 18. So this is a genetic disorder, and you can remember trisomy 18 because of the E in Edwards syndrome and the E in 18. What is the best next step in a patient with historical findings of mixed incontinence? So this is a diary or a log. So the patient takes a log of their urinary symptoms, what they are and when they occur. And with that log, you'll be able to decide which one is a prominent urinary disorder or primary type of urinary incontinence. What is the best way to prevent the transmission of the rotavirus? Proper hand washing. What type of urinary incontinence is most likely to be seen in women with menopause? Stress incontinence. Estrogen is very important to maintain the tone and strength of the pelvic floor muscles. However, the decreased estrogen seen in menopause causes a decreased tone of the pelvic floor muscles. Other causes of stress incontinence include pregnancy, obesity, and having multiple children. Stress incontinence is usually treated with Kegels and a mid-urethral sling. What is the most common location of breast cancers? The upper outer quadrant. So breast cancer is an extremely high-yield topic for the USMLE, so comment below if you would like to see a video about this. What is the greatest risk factor for endometritis? C-section. So these patients usually present with fever and uterine tenderness like 2 days after a C-section. Knowing endometritis and chorioamnionitis is extremely high yield because they have so many overlapping features. So I'm going to link a video that I did distinguishing between these two infections. So be sure to check the description of this video for a link to that. What causes periventricular calcifications, sensorineural hearing loss, jaundice, and hepatosplenomegaly? CMV infection. How I remember it is the V in CMV and the V in periventricular calcifications. However, in let's say toxoplasmosis infections, they have intracranial calcifications. So that's how I remember which calcifications belong to which infections. What are the clinical features of rubella infection? Cataracts, a machine-like murmur, and hearing loss. And of course, this machine-like murmur is a PDA or patent ductus arteriosus. Is bladder dome rupture an intraperitoneal or extraperitoneal injury? It is an intraperitoneal injury. What is a common cause of third-degree heart block in neonates? Neonatal lupus. Anti-Ro antibodies are elevated in the majority of cases of neonatal lupus. Neonatal lupus is associated with the transfer of maternal antibodies like anti-Ro and anti-La or anti-LA. And of course, the classic symptom or sign of this is a congenital AV block, but they may also present with other features such as a periorbital or diffuse rash, and this typically presents during the first weeks after birth. And they could also have hepatitis with elevated liver enzymes or a cytopenia. In what conditions is pulsus paradoxus seen? Cardiac tamponade, asthma, and COPD. So a pulsus paradoxus is an exaggerated fall in systolic blood pressure greater than 10 millimeters per mercury during inspiration. So just remember, a drop in systolic blood pressure more than 10 during inspiration could be due to cardiac tamponade, asthma, or COPD. And that description is for pulsus paradoxus. What is the most common cause of conjunctivitis in the first 24 hours of life? Chemical conjunctivitis. So, in newborns, the most common cause of conjunctivitis in the first 24 hours of life is chemical conjunctivitis. However, following that, within 2 to 7 days, the most common cause is gonorrhea. Then at 5 to 14 days, the most common cause is chlamydia. So that's like CGC for the timing of these conjunctivitis. C for chemical, G for gonorrhea, C for chlamydia. CGC. Occlusion of which artery causes a right ventricular myocardial infarction? Proximal right coronary artery. What electrolyte abnormalities are seen in rhabdomyolysis? Hyperkalemia, hyperphosphatemia, and hypocalcemia. Recall that rhabdomyolysis is a breakdown of skeletal muscle tissue that can be traumatic or non-traumatic. Traumatic causes include like a direct injury or a crush injury. However, non-traumatic causes include seizures, overexertion, like let's say a marathon runner, infections, adverse drug reactions, and intoxications with drugs such as alcohol or heroin or even cocaine. These patients also experience acute tubular necrosis leading to acute kidney injury, and they also have a buildup of lactic acid, which can lead to metabolic acidosis. They have the classic triad of darkened urine, myalgia, and generalized weakness. And please note that the dark urine is not due to blood. Like if the patient does a urine dipstick, it will detect blood. But if you look under the microscope, there isn't blood there. It's actually myoglobin from the breakdown of the skeletal muscles. What type of pericarditis can survivors of Hodgkin lymphoma develop? Constrictive pericarditis. So, survivors of Hodgkin lymphoma are at an increased risk for cardiac disease. This can present 10 to 20 or even more years after receiving mediastinal radiation or anthracycline therapy. If you're enjoying these high yield facts so far, be sure to click the like button, hit subscribe, and that notification bell so you don't miss any more videos like this. What bone tumor is retinoblastoma associated with? Osteosarcoma. What is the most likely cause of a subauricular systolic bruit in a young woman? Fibromuscular dysplasia. I made a video about this topic, so I will link it down below so that you can learn high yield ways that hypertension in young women is most commonly tested by examiners. What conditions can cause carpal tunnel syndrome? Pregnancy, rheumatoid arthritis, and hypothyroidism. So, carpal tunnel syndrome occurs when there is entrapment of the median nerve, and this affects the radial 3.5 digits. These patients may also have a positive tunnel sign. That's when percussion over the nerve causes a pins and needles sensation in the distribution of that nerve. Or they may also have a positive Phelan sign. So for me, it kind of seems like reverse prayer hands. Because with prayer hands, hands are pointed up and the palmar surfaces are touching. But with the Phelan's test, it's reversed, so the dorsal sides are touching and the hands are pointing downwards. So if a woman is pregnant and she has carpal tunnel syndrome, this syndrome may resolve once the patient gives birth. And for the other causes of carpal tunnel syndrome, once these conditions are addressed, then those symptoms may resolve. Like let's say if the patient had hypothyroidism and carpal tunnel syndrome. Once we manage their hypothyroidism, then their carpal tunnel syndrome may resolve as well with that management. If not, we can use wrist splints, and if that doesn't help, we can use NSAIDs steroid injections, or carpal tunnel release. What is the most likely cause of normal thyroid hormones but no visible thyroid on CT? Lingual thyroid. What organism causes bloody diarrhea and a liver abscess? Entamoeba histolytica. This protozoal infection can also be treated with metronidazole. What is the most common cause of neonatal hypothyroidism? Thyroid dysgenesis. What is the most common cause of sudden cardiac death during acute myocardial infarction? VFib. And be sure to hit the thumbs up button if you would like to see more videos like this. What organism most commonly causes corneal ulcer or conjunctivitis in contact lens users? Pseudomonas. What neurological condition can result if hyponatremia is corrected too quickly? Osmotic demyelination. What can be seen on the ECG of a patient with digitalis toxicity? Atrial tachycardia with AV block. I think it's very high yield to know drugs like digitalis, amiodarone, lithium, because they have so many side effects and very high yield points. So I think I'll be making a video about those drugs so that you can have easy ways to remember them. What groups of people usually do not get live vaccines? Pregnant women, patients less than 1 year old, CD4 count less than 200. So the only exception to the patients less than 1 is that they're given rotavirus. So that's a very, very high yield point. If a patient has porphyria cutanea tarda, what should they be screened for? Hepatitis C. What murmurs can be seen in carcinoid syndrome? Tricuspid insufficiency and pulmonary stenosis. This can be remembered with mnemonic tips. What organism causes hyperintense lesions in the temporal lobe in a patient with HIV? herpes simplex virus, or HSV. If you liked this video, be sure to power up the like button. If you have any cool mnemonics to help the community remember anything discussed in this video, be sure to comment below. Also, make sure that you subscribe and hit the notification bell so that you don't miss any videos like this. To continue learning, click this video right here. Thank you for watching.